So just to tell you a little bit about myself and my perspective I'm coming from, I'm a clinical psychologist by training, and I'm a scientist at the University of Wisconsin Center for Tobacco Research and Intervention in Madison. And I'm also a clinician in our PTSD outpatient recovery clinic at the VA hospital in Madison, where I work with veterans who are struggling with PTSD and often a number of other substance use related disorders. So today I want to talk a little bit about e-cigarettes and vaping and try to get at some of the complexities, sort of the double-edged sword that e-cigarettes pose to our society and different perspectives that we might think about when considering this device and topic. Of course, these are my own opinions I'm talking about today, and so I don't necessarily, what I have to say doesn't necessarily represent the University of Wisconsin or the Department of Veterans Affairs. And I am going to talk about both FDA-approved tobacco smoking cessation medications and harm reduction perspectives on e-cigarettes. So we've got three goals to try to get at today. First, want to talk about harm reduction potential of electronic cigarettes and vaping compared to combustible commercial tobacco cigarettes. Want to talk a little bit about the clinical and public health concerns that are associated with vaping. And then finally, leave you with some free tobacco treatment extenders that you can think about incorporating into your clinical practice that are available to anybody in Wisconsin. And so all the links in my presentation, I think you can download the PDF, should be clickable and be able to take you to the resources that are here. So to start off, I think it's important to acknowledge that e-cigarettes are a pretty complex landscape, both from a science perspective, from a regulatory perspective, from a clinical perspective. They came on the market around 2007 in the United States, and it's just really rapidly evolved over the past almost 15 years now. And they often come with strongly held and controversial opinions. So I'll try to do justice to a variety of perspectives. I tend to be a harm reductionist at heart, and so that's kind of where I want to start out, thinking about how we can view vaping and e-cigarettes relative to tobacco cigarettes, which I know often I believe this group is focusing on opioid use, which is a tremendous problem here in Wisconsin, and recognizing that cigarette tobacco is still the leading cause of preventable morbidity and mortality in the US and in Wisconsin as well. And so it remains a really huge public health concern. So let's start by talking about harm reduction or harm minimization. Obviously, and this is just a heuristic of how we can think about the spectrum of nicotine and tobacco products. On the left side, obviously, no use, representing the least harmful option. And on the far right, combustible commercial tobacco cigarettes being the most harmful for any number of organ systems and health outcomes. And we can think about e-cigarettes really as falling into this left side of the spectrum, where we've got our FDA approved, our 5 FDA approved nicotine replacement or NRT treatment options. So patch, oral products like lozenge or gum, and nasal spray as being the least harmful, and e-cigarettes probably very closely behind there. But if we think about these as a class of products, compared to cigarettes, it's night and day. In 2018, the National Academy of Sciences, Engineering, and Medicine brought together a host of experts from a range of disciplines and put out a consensus report about a variety of topics related to e-cigarette use. And at that time, they were pretty strong, saying there's conclusive evidence that completely substituting e-cigarettes for combustible tobacco cigarettes reduces exposure to numerous toxicants and carcinogens present in combustible tobacco cigarettes. And so at this point, there's really little doubt that when we're thinking about relative harms, if somebody's using vaping or e-cigarette versus tobacco cigarettes, there's basically no comparison in which one's going to be more harmful. And there's substantial evidence that completely switching, which is a key factor, as opposed to continuing to use both e-cigarettes and vaping, completely switching from combustible cigarettes to e-cigarettes will reduce short-term adverse health effects on a number of organ systems, and we can, likely take the logical leap in the long term that there's going to be significantly reduced harm as well, although often we tend to hedge because the evidence is not there yet in terms of what we know about the long-term health effects of e-cigarettes, since they have only been around for a handful of years. In terms of the evidence for cessation, at this time, it was still somewhat limited in 2018. But shortly after this report came out, there was a big study in the New England Journal of Medicine, the link's here at the bottom, from the UK, where they compared with the National Health Service. Obviously, a very different health system and infrastructure across the pond. They compared e-cigarettes to any number of nicotine replacement therapies that patients could choose which kinds they wanted to use, or a combination of EMA-approved nicotine replacement therapies. And that study found that was the first large RCT of e-cigarettes for smoking cessation, cigarette smoking cessation. And the rates of quitting 1 year out were about double when folks were using e-cigarettes compared to the pharmaceutical formulations of NRT. So that was really one of the first big milestones in our understanding of the use of e-cigarettes for cigarette smoking cessation. And Cochrane, which many folks might know as sort of a go-to trusted source of information, has this rolling review for e-cigarettes because the information is evolving so rapidly. This is really kind of a situation where the marketplace is evolving so quickly that the science and research and clinical health information is just sort of trying to keep a pace and keep up with what's going on in the marketplace. But they just came out with their most recent update last month, suggesting that nicotine e-cigarettes probably do help people stop smoking for at least 6 months. We don't know about longer term. And they probably work better than nicotine replacement therapy, and in particular compared to nicotine-free e-cigarettes. It is important to note that most e-cigarettes contain nicotine, but that's not necessarily the case across the board. And when we talk about youth in a little bit, it's important to note a lot of youth don't even necessarily know that nicotine is a component of many of the e-cigarettes that they're using.
Jesse, can I interrupt for just 1 second?
Yeah, please.
You may get to this later, but just in case it fits well with what you're saying now, and you weren't going to, there was a question around sort of reports around poisoning events related to e-cigarettes, and how you think about those in the context of the harm reduction that you're talking about.
Yeah, that's a good question. And I don't have the chat open, so Randy, feel free to jump in if there's other questions. So, I mean, E-volley was the big scare about 2 years ago, and that actually, was first identified here in Wisconsin and Northern Illinois. And that, was a very serious, concerning lung injury related to vaping. It ultimately turned out that that was most likely due to vitamin E acetate that was being added to THC vape devices, and was very unlikely due to commercially produced nicotine-containing e-cigarettes. And the rates of that have gone down quite a bit, I believe, the last year or so. I'm not sure. I guess, are there other specific questions about toxicity?
No, that was, yeah, I think you
Okay.
addressed
Well,
that. And then
I,
the other thing,
actually, I asked that
oh,
question.
sorry.
I was kind of concerned about the e-liquid, that infants and children getting a hold of that, and also
Mm,
other tobacco products. Like 2-year-olds will put everything in their mouth, and a toxic dose of nicotine for a 2-year-old, it's like 1 milligram per kilogram, if I'm not mistaken. And so
mhm.
the e-liquid, a dose of that, or even like, one of the snus or something like that, may poison an infant. So I was just wondering if you had any information about that.
I don't know tons about that area. I mean, so for example, a Juul pod contains about the same amount of nicotine as a pack of cigarettes. And so, yes, keeping out of the hands of kids, little kids in particular, is a concern for nicotine overdose or toxicity. Um, for young kid accidental toxicity. Yeah.
But, and this
And
is Sheila, just one other observation with that, the fact that that Juul pod contains a pack of cigarettes. What we're seeing is adolescents knocking back what they wouldn't have time to smoke in traditional cigarettes. So the
Yep.
dose of nicotine they are consuming and the fact that the long-term addictive effects along with brain impact isn't known because it's too short. I'm very cautious about this kind of coming across as a no big deal. This is
Yes.
the answer kind of thing. Very concerned.
Yeah. Yep. No, I appreciate that, Sheila. And yeah, my hope, I'll try to speed up a little bit because my hope is to balance the harm reduction perspective for current cigarette smokers with the very big and real concern about, you know, um, what the Surgeon General declares an epidemic of youth vaping starting in 2018. So why don't we keep going for the sake of time and try to make sure we touch a little bit on the wide variety of issues and concerns here. So this was just a brief editorial put out by the two directors of the center where I work at, the University of Wisconsin Center for Tobacco Research Intervention. And I think their title really kind of says a lot about uh, the state of affairs with vaping is there's just a tremendous amount that we still don't know about e-cigarettes because they are relatively new on the market, and there's been changes rapidly over the past decade. So we still don't really know how effective e-cigarettes are for long-term abstinence for cigarette smoking because there haven't been those long-term follow-up studies. And especially among those making unaided quit attempts outside of a healthcare setting without the assistance from physicians or prescribers or other healthcare professionals. And we don't know, while we do have 7 FDA-approved medications, varenicline and combo NRT, so that's patch, nicotine patch, plus a PRN formulation like gum lozenge or mini lozenge, are the 2 most effective uh, smoking cessation strategies, and we don't know how well e-cigarettes stack up compared to that. So for your current combustible commercial cigarette smoker, I think it's fair to say at this point that if they are able to completely 100% switch over from e-cigarettes, my first go-to is always, I'm not a prescriber, but would be to recommend one of our FDA-approved pharmacotherapies to help somebody quit smoking. That said, we know people are coming in saying, "Hey, what do I do? I'm interested in using e-cigarettes to try to quit." Um, so some of the clinical considerations, concerns, or pieces of advice, we do know that one of the concerns is that people who start using e-cigarettes to quit smoking combustible cigarettes, a large majority end up being dual users, and so ultimately end up using both products rather than actually achieving their goal of quitting smoking cigarettes. And we still don't really know too much about how great of a harm reduction benefit we get when people are still using both products. There remains unknowns about the long-term health effects, as I mentioned. There's secondhand smoke or vape exposure concerns. And for example, in that the study in the UK where they did a randomized control trial, 80% of people who were assigned to use e-cigarettes to help them try to quit smoking were still smoking or still using their e-cigarettes 1 year later. So, and that's compared to a very small handful of people who are still using their NRT a year later. So there's really high rates of continued use of e-cigarettes among people who use this as a strategy to quit smoking cigarettes. We don't, each of these bullet points could, take half an hour to talk about. There are definitely concerns about big tobacco using, Altria, one of the biggest tobacco producers, companies in the country, is heavily invested in Juul. And so a lot of the traditional tricks we've seen, over the past 6 decades from the tobacco industry have been very apparent among e-cigarette marketing, lobbying, et cetera, over the last 10 years or so. It'll be interesting to see just this last week, this attorneys general in North Carolina started their first case against Juul for marketing against to youth and teens. And so I guess before I switch over to talk about youth, the other point I'll just make is that different countries have taken different approaches. So the UK is really pushing and using e-cigarettes as a smoking cessation pharmacotherapy. The US, we have certainly not seen that route being pursued. And in fact, there's lots of research roadblocks in our country due to the regulations of e-cigarettes as a tobacco product. And so it's really handcuffed researchers' ability to a large extent to be able to study cigarette smoking cessation with e-cigarettes. And so that's one of the many reasons that there's just a lot we don't know. Also, the regulatory climate is really complex. So one example is a couple years ago, certain flavors were banned in e-cigarettes where it was sort of a one-stop shop. The whole device was put together, but there was a loophole where you could still produce flavors if they were in disposable pods. And so that was one way that the industry was largely allowed to sort of get around the flavor ban and continue marketing to youth. And so to Sheila's point a few moments ago, I think any discussion of e-cigarettes can't be complete without acknowledging the really real concerns about the youth vaping epidemic we're seeing in our country now. So I'll point us to, so this is a graph of current, this is an epidemiological survey that has gone on in the US for a long time. And starting in 2011, they started monitoring e-cigarette use among high school and middle schoolers in the country. And if we see from 2017 to 2018, this was the biggest jump we've ever seen in the history of epidemiological research in the United States on drug use in any drug class. So there was a 10% increase in high school students just in a single year period, which is just an astronomical jump in such a short period of time. Juul came on the marketplace in 2015, and over the last number of years, the marketplace has really revolutionized. Two of the big things they've done, they've obviously taken a marketing strategy, which many are saying is very directly targeting youth. They did voluntarily pull, one of their most popular fruit flavors a couple of years ago proactively before the FDA made them do it. But they are using a new formulation of nicotine salts and adjusting the pH to make the nicotine hit from Juul and other like devices much smoother and more amenable to youth. And so the vast majority of kids who are using tobacco these days are using e-cigarettes. And so this is just a shot from the most recent CDC report, the MMWR, where they're showing youth, high school and middle school tobacco use. And this is just 2019 and 20. But basically what we see is that now cigarette smoking is at an all-time low among high school and middle schoolers due to tremendous public health efforts over the past 50 years. And so there's a real concern that we might be seeing the start of a change in that trend, because e-cigarette use is far and away the leading nicotine product that youth are using now. And so there's real concerns that this could be a gateway re-entry for youth to start using e-cigarettes and then transitioning to combustible commercial cigarettes. We know that 9 out of 10 high schoolers who smoke cigarettes are also e-cigarette vapors. And while, it's a little hard to say, which led to which, there's increasing evidence that e-cigarettes are sort of greasing the tracks to increase cigarette use. I realize I'm starting to run short on time, so please, Randy, feel free to jump in if there's chat questions or discussion points. This is from the Wisconsin DPI, the latest survey that they do each year. 2020, I believe, didn't happen. I'm guessing maybe due to COVID. But in 2019, just some quick stats. We've got high rates of e-cigarette use among high schoolers in Wisconsin, and this is a really concerning problem among high school students and middle school students even. So before I talk about some clinical resources, just kind of overview that the landscape is rapidly evolving. The device types have changed a number of times over the past decade. Nicotine content in these devices is changing, whether you can access flavors which are much more appealing to youth is a major concern. I always recommend folks, prescribers who are working with people who want to quit smoking cigarettes. One of our 7 FDA approved medications, which is not including e-cigarettes right now, using a medication and counseling will double or triple somebody's rate of successfully quitting in the long term. Of those medications, varenicline or Chantix or combination nicotine replacement are the 2 most effective options. For somebody who's tried everything and is really interested and motivated in using e-cigarettes, you can let them know we are pretty confident that e-cigarettes are less harmful than using combustible cigarettes when completely substituted. Some of the concerns are whether people can start using both products and not actually reduce their nicotine dependence and not get the full benefits if they continue to smoke in the long term. And there's a host of public health concerns, just bullet point a few down there. The next few slides, there's just a bunch of clickable links that you can use at your leisure. The Wisconsin Tobacco Quit Line can provide free NRT and counseling for folks who are interested in quitting tobacco products. And smokefree.gov has a program that's tailored towards teens who want to quit vaping. They have texting programs. The Truth Initiative also is a really great resource. I think about these as sort of treatment extenders to what you can do in your clinic or community-based setting as free, easily accessible treatment extenders that are tailored, particularly the bottom 2 towards youth. University of Wisconsin Center for Tobacco Research Intervention has a host of resources as well. We've got a page on e-cigarettes and vaping that has a lot more information, educational information. Some of my colleagues have developed a tobacco treatment CEU program for behavioral health providers in particular. And the outreach team there provides personalized clinical training for healthcare systems and providers to try to enhance and integrate tobacco treatment into your clinical practice. So those are some other nice free resources. If you're looking at more information and treatment guidelines, we got the US Surgeon General's report, these 2 resources that I mentioned earlier, and I will leave my contact information up there. So if anybody has questions afterwards, we've got a few minutes here, but I'm also happy to connect with folks offline